Hello everyone, my name is Riyad Bouafa. I am a geneticist from Algeria. Today, I am speaking as part of the Affirmative Team, Team C, alongside my colleague Elijah from Nigeria. Our question today is should African countries create regional genomic databases to advance research in cancers that disproportionately affect their populations? Our answer is clear yes, and urgently. Genomic databases are comprehensive collections of genetic information, including DNA sequences, genetic variation, and functional annotations. They enable researchers to analyze genomic data for disease discovery, diagnosis, and treatment optimization. At the same time, cancer is rapidly becoming one of Africa's, Africa's most urgent public health crises. Cancer-related deaths are projected to increase by more than 70% by 2040. While global oncology is shifting toward precision medicine, Africa, despite having the greatest human genetic diversity on Earth, remains severely underrepresented in genomic databases. Creating regional African genomic databases is therefore a decisive step toward building cancer care that truly works for African populations. Cancer already represents a major and escalating public health challenge in Africa. In 2022 alone, there were over 90,100 new cancer cases and more than 580,000 cancer-related deaths. Precision medicine depends on population-specific genomic data. Without African genomic data, diagnoses become less accurate and treatments less effective. This is why regional genomic databases are essential, not optional. Moral and public health imperative, the first argument. Our first agreement is a moral and public health imperative. Cancer incidence is rising rapidly across Africa. Yet, current cancer care relies overwhelmingly on non-African genomic data, leading to inequitable and often inaccurate care. African populations must be represented in the data that guides modern cancer treatments. By 2040, cancer deaths in Africa are expected to double to 1.4 million annually. Today, 98% of genomic data used in medicine comes from non-African populations. Continuing this imbalance is not only scientific flaw, it is ethical and unacceptable. Second one, scientific opportunity and urgency. Africa has the highest genetic diversity in the world, yet this diversity is barely represented in global cancer genomics. Understanding African cancer biology requires African genomic data. Regional databases unlock new discoveries, novel biomarkers, and therapeutic targets. For example, African women are twice as likely to be diagnosed with triple negative breast cancer, the most aggressive subtype. Precision medicine cannot exist without population specific genomic reference data. Equity and precision medicine. Genomics already guides cancer screening, classification, and treatment worldwide. The lack of African genomic data directly widens global health disparities. Regional genomic databases ensure accurate diagnosis, effective therapies, and equitable outcomes. Without them, African patients remain excluded from the benefits of modern oncology. Strategic and economic framing. Genomic infrastructure strengthens national and regional research capacity. It reduces dependency on foreign diagnostics and external technologies. It supports cost-effective prevention and early detection strategies. Sorry. Most importantly, it positions Africa as a contributor, not merely a consumer of global biomedical innovation. Presents the urgency. The future of cancer care is being built right now, largely without African data. Using non-African reference genomes leads to misinterpretation of variants and clinical errors. Regional genomic databases are essential to avoid long-term scientific exclusion and structural inequality. Africa has more urgent health priorities. Cancer is already a major public health crisis in Africa. Genomics strengthens prevention, early detection, and long-term sustainability. Ignoring genomics today increases healthcare costs and cancer mortality tomorrow. Genomic databases are too expensive. Sequencing costs have dropped dramatically. The cost of sequencing a human genome has fallen from $100 million in 2001 to less than $600. Sorry, to less than $600 today. Regional collaboration reduces duplication. Genomic infrastructure benefits multiple diseases, not cancer alone. Investing locally reduces dependence on costly and inappropriate foreign treatments. Genomics won't improve outcomes in the short term. Genomic data already improves diagnostic accuracy today. Better reference data enhances variant interpretation immediately. Foundational genomic data must exist before translation into clinical care is possible. Delaying investments only delays ethical and privacy risks are too high. These risks come from weak governance, not from genomics itself. Regional databases allow Africa to define its own consent rules. Local governance reduces exploitation and protects population data. Population-specific genomic data is essential for accurate cancer diagnosis. Regional databases strengthen healthcare systems and research capacity. Investing now reduces cancer mortality. This is a transformative opportunity for Africa. Regional genomic databases are essential to understand African cancer biology, improve diagnostics and treatments, empower African researchers, reduce global health disparities. Our arguments are supported by extensive peer-reviewed literature, including Nature, the Lancet Ecology, WHO reports, and major African genomics initiatives. Thank you for your time. We welcome your questions. Thank you.